Welcome, viewers and followers. We're here at Havana Plastic Surgery with Dr. Hamamdin.
Perfect.
How are you?
Good. How are you?
Good. So, here at Havana Plastic Surgery, we know him as Dr. H for short. So, if you are interested in any type of procedure, Dr. H or Dr. Hamamdin
Perfect.
is having great prices in all of his procedures. So today we're gonna talk everything that deals with mommy makeovers. And mommy makeovers are for females and males, correct?
So, mommy makeovers, I say for females, but the components of it you can apply towards men as well.
Nice.
So, the basics of when you're talking a mommy makeover include a tummy tuck and some sort of breast surgery. There's a little bit of confusion, I think, when talking to patients sometimes. So, the name is very cute, but I tend to break it down into saying like tummy tuck with a breast aug or tummy
Right.
tuck with a breast lift, or whatever combination of that, or with liposuction to help clarify that. And then the running joke would be that men can often use the chest liposuction and tummy tuck too. So
Perfect. Good to know.
Yeah.
So question number one about mommy makeover. That was practically already question number one. So
Yeah.
let's do question number two. What exactly does a mommy makeover entail?
So in terms of what it incorporates, like I said, a tummy tuck and some sort of breast surgery.
Okay.
The reason that it kind of came to phrase was just related to pregnancy, that with breastfeeding, things like that, the
Right.
body changes, right?
Yeah.
And I like to promote body positivity, as does Ivana, that, not everyone necessarily needs surgery or necessarily needs the same kind of surgery, but it's about what's important to that patient and what makes them feel good. So I
Right.
think really understanding and taking the time to talk with them to really achieve their goals is what's key. And that was one of the things that I love about, Ivana as well. So,
Would you suggest a mommy makeover once a woman is done with having kids?
Yeah.
Yeah.
So in terms of a tummy tuck, one of the key things that we'll ask in general, even if it's not a mommy makeover, is does that patient have the desire to become pregnant? Because we tighten those abdominal wall muscles a lot of the time. And with
Oh, okay.
pregnancy, you want to be cognizant of that. It doesn't
Right.
mean that someone who's had that tightening can't get pregnant. But again, it's just something to consider because, why do the work once if you're going to get pregnant, a
Right.
year later and then have
Yeah.
to redo it again, possibly.
Yeah, true.
So.
Okay, good to know. I'll take a tip. So if you are done with kids, if you don't want to get pregnant anymore, think of a mommy makeover. That's a procedure for those type of women that are done with kids. How long does it typically take to recover from a mommy makeover?
It just depends. Everyone's a little different. Obviously, you're kind of stacking two bigger surgeries together. So you can break them apart. You could do the breast surgery and then do the tummy tuck. It's really about working with the patient for whatever suits them. That's
Right.
the key. If you're doing both together, 6 to 8 weeks is reasonable. I think the most challenging part of, even if you do them separately, most patients will say the tummy tuck puts them down for a little bit longer, just because, again, you're messing with the muscle a little bit more in that situation where you're tightening it almost like a corset. So patients will feel a little bit tight, but, everyone makes it through it. There's a reason that women have kids
Yeah.
and not men.
We're strong.
Men, we tend to be a little bit more babies when it comes to the
Very
tummy
true.
tucks, but everyone does great. So.
What are the most common procedures included in a mommy makeover, which you practically already said, but I have a question. Can people include a breast aug with implants in this, or?
Yeah, that's a great question. So when we're talking for the breast portion of the mommy makeover, so we'll kind of break it into breast and tummy tuck portions. So the breast portion, that may mean that a patient needs a breast aug, which is to increase the volume, saline silicone options, and then potentially a lift as well. The lift is necessary when that nipple has fallen kind of below that inframammary crease, so that crease that even men have a little bit below
Right.
our chest, to lift that nipple into the correct position. Sometimes, if they just have a little bit of a drop, you can use the implant to accommodate for that, so they don't necessarily need a lift. But again, it's really tailoring each surgery for each patient.
Good to know.
Yeah.
Are there any risks or complications associated with a mommy makeover?
Yeah, so I think the general complications, if you break it into the two things still, tummy tuck and breast aug, you have your basic risks that we go through in in-depth consent. We talk with patients. It's one of those things that, when you read the black label warning on Tylenol even, it lists
Yeah.
everything out. So we like to go through everything. That doesn't mean that we see everything, but it's just part of that informed consent. I would say the most common things tend to be sometimes you get a little bit of wound separation, which you can get to heal. And it's patience, and also knowing as a surgeon how tightly to close the tissue.
Right.
If it's too tight, you're going to be more at risk of something opening. And we like to keep everyone safe as well. And that's the biggest thing for me when it comes to combining procedures, is making sure the procedure doesn't last so long that the patient's under anesthesia for 8+ hours or something crazy like that, their risk of blood clots and things like that can go up. So we like, again, safety is number one.
Safety is your top priority.
Yes, always. As is, a good result, but above that is always safety. So, and we can always break it down into two things if necessary, but just safety.
Great to know.
Yeah.
Okay, so going back to the question, how soon after childbirth can someone undergo a mommy makeover? So how soon after someone had kids can they do this procedure?
Sure. Surgery in general, at least 6 months. If the patient is breastfeeding, you have to take that into consideration as well if you're placing a breast implant and things like that, because the ducts that provide the milk, we all have bacteria in our bodies and things like that. So if you're still producing milk, it can put the implant at risk of infection. And so ideally, exactly, waiting about 6 months until the breastfeeding has stopped when you're talking about an implant. But in general, that aside, at least 6 months, because you don't want the risk of blood clots and things like that to go up. Because with childbirth and pregnancy, that's a risk. And so if you were to combine those together, it makes the person at higher risk. So you want to give people time. It's not emergent. And also you want to give the patient time to
heal.
The body to, and reacclimate. And, if they had gained a little bit of weight during pregnancy, perhaps they want to stabilize that weight before getting surgery is really key too. So if they wanted to lose, say, 10 pounds or something after pregnancy, giving them that time for that weight to stay a little bit stable. And that makes our job easier and gives them really that beautiful result.
Perfect. How long do the results of a mommy makeover typically last?
It depends. I think any surgery is an investment, is kind of how I was once explained. When someone mentioned that to me, it was about a facelift, that it's an investment. It's something you want to protect and maintain and take care of. So someone who's taking care of their body, eating right, exercising, it can last a lot longer than, say, someone who's not necessarily taking care, eating the diet they should be, exercising, things like that. Now, that being said, everyone's on a spectrum. But if you plan to lose, say 40 pounds after surgery, well, chances are you're going to need, skin excision or a change in your breast implant, something like that. So it really depends. Nothing is ever permanent, but at the very least, it's hard to say because it's really individually based, but I would think at least 5 to 10 years. And again, if you maintain it well, it could last you the rest of your life. But at the same time, with aging, we lose collagen and things too. So your skin changes, we get a little bit more sagging, a little bit more fat pockets. So it wouldn't be unrealistic to say,
So as long as the patients maintain a healthy lifestyle, diet, and all of that, the results should maintain.
Yeah, I would say that.
Perfect. Good to know. What should I expect during the consultation process for a mommy makeover?
I think just taking the time to go through everything, as we do with every patient. Mommy makeover aside, getting a thorough history, establishing that relationship with the patient, finding out what's really important to them. I think taking that time to really see eye to eye and hear the patient is what's key. There was that form of training, I think, in the past where people came in to see the doctor said, okay, you need this, and there wasn't always a discussion.
Right.
And I think one of the things that works really well for me is just taking that time to say, okay, what's important to you? And then sometimes the patient already, is spot on with what they think they need. Sometimes it's having that discussion of, okay, well, we can adjust it, and this is, some other things we can offer as well, or, and it's really just taking time to talk to people and, enjoy that conversation and help them reach their goal.
Can patients bring you a wish picture?
Yeah, I don't see why not. Wish pictures aside, I'm a little bit jaded. For a millennial, I think everyone gets photoshopped online. Yeah. So, nothing is ever as accurate as in person. Obviously, our pictures online are not. But, a lot of the time when we're talking celebrities, things like that, or the general public, we've all had that date, I think, where sometimes you looked at their picture on Tinder or whatever, and then, they've had airbrushing, whatever's been done. But it does help. And I think that is actually, I appreciate it because it gives you a little bit of an idea sometimes of, okay, even for breast size, that you want to be maybe an A cup, B cup, C cup, that kind of thing. So I think it is helpful for me.
Okay, perfect. Well, thank you so much for answering these questions about mommy makeover.
Thank you.
Dr. H or Dr. Hamamjin, however you guys prefer to call him, he's having a lot of promotions right now. Right now, he has the match deposit promotion where you could deposit up to $1,000. We will duplicate that and then deduct that off the total amount of your procedure done with the one and only Dr. H. So again, thank you so much
Thank
for
you.
being here.
Yeah, thank you so much.
Can't wait to see you